Hi, I'm Dr. Koumanis, and I'm a board-certified plastic surgeon here in upstate New York, covering Saratoga, Queensbury, Glens Falls, and the whole capital area region. And today we're here to talk about a facelift and a neck lift. Sometimes those both go hand in hand and are done together, and other times the neck lift is done in a separate procedure. The facelift and the neck lift are usually sought out by people who are mostly females in their 50s and 60s. It's usually from sagging skin, and people call it their gobble neck, and also jowls. The jowls are the where it sags right around here along the jawline, and they seek to get the facelift pulled. Now, in order to do a proper facelift, it should look natural and not severely pulled, because that can look freakish. And everybody knows some of these celebrities that have had really bad facelifts. A facelift should look natural, and the patient should look rested rather than pulled. How is the facelift performed? Well, first of all, we have to screen you. You cannot be a smoker, as a smoker can cause the skin to die in areas around here and here if you're a smoker, and therefore I ask my patients, if they're smokers, to have quit at least 6 weeks. I verify that they have quit smoking through blood and urine samples. And it's imperative that they quit smoking for their own safety. Also, any sort of blood pressure issues should be rectified by your primary care physician or cardiologist. Blood pressure can cause bleeding and cause flap necrosis after the surgery along here, along the cheek, or along the neck, and therefore we try to get the blood pressure under control or under medication if needed. Also, patients shouldn't be taking anything that causes bleeding. That could be herbs and vitamins. For instance, vitamin E can cause bleeding. Ginkgo biloba, ginseng, garlic, St. John's wort, and a whole slew of them can cause bleeding. So you should bring a list of all herbs and medications that you take. Ibuprofen and any sort of aspirin products are asked to stop 7 days prior. The herbs and vitamins are also asked to be stopped about 7 days prior to the operation. Now, the operation is approximately 3 hours under general anesthesia, and when performing the neck lift, we make an incision underneath the neck here, and we tighten all the muscles and the skin here. We also make incisions around the ear and behind the ear in order to pull the neck skin tight, and just tight enough so it looks natural. Facelift is performed by making incision along the line here just in front of the ear, and we try to hide it within the ear, and it's hidden very well. The incisions are not very well seen after an operation, and hide very well. We lift up flaps, and as we lift up flaps, we go towards the mouth on each side like this, and then we lift them up and pull, and then cut out the excess skin that is required in order to pull that. And then everything is sewn up in 2 layers, and sometimes you need some drains just for a few days, and then you're wrapped in some soft foam after the surgery. Patients get great results and are usually really happy that they've done the procedure. Facelift and neck lift also have a very high rate of satisfaction with patients. So if you are in need of a facelift, or you think you're in need of a facelift, or want a consultation to evaluate yourself for one, please feel free to contact us at www.capsny or 518-203-2593. Call us or get us online, and we'd love to see you at a free consultation.